please like, share and subscribe to increase awareness about organ donation. Today I'm going to do just a short video and talk a bit about how I sleep during peritoneal dialysis. So the type of peritoneal dialysis that I do is called automated peritoneal dialysis, which occurs whilst I'm asleep at night and usually takes up to 8 to 8.5 hours. And this is one of the most requested questions I get asked about. How to be very frank in that, yes, it is extremely difficult, especially in the beginning when you start doing automated peritoneal dialysis. It's going to take about 2 to 3 months to get used to this type of dialysis, and you may not even sleep for the first 4 to 5 days, after which you'll be exhausted and then just sleep out of exhaustion. So let's move on to the video and I can show you how I actually sleep. The first thing you can see and that you want to be mindful of is that you want to have the catheter in your hand every time you stand up or sit down. This is because you don't want to end up sitting on a catheter and making it sort of pull out of your exit site, as this can cause a lot of bleeding and can compromise your exit site to infection. If you do get infection in your exit site, then it's going to require a lot of strong antibiotics that that may even compromise your dialysis in the future or CAPD line, and it may have to be taken out, and you'll have to be put on hemodialysis. And this will involve a whole other range of operations where you have to have a fixilla put in, and your dialysis may work, may not work. So you want to try to avoid that as much as possible. Um, so the first position that you can sleep in is on your back, so in the supine position. And you can imagine that you'll probably have the blanket over you as well. I've just done it without the blanket just so that you can see which positions you can actually sleep in. The next position is on your left side. So you may have to rearrange your pillow slightly to make it more comfortable for you. And the final position that you can sleep in is on your right side. And you'll notice that on my catheter has been inserted on the right side of my abdomen. So I just give it a slight pull sometimes just to make sure that there's no blockages in the line and to make sure that that the fluid is able to flow freely through into my stomach and out of my abdomen. And I mean, that's the most requested questions from patients is, can you sleep on your side? Because some people are side sleepers, and I would say yes, you can sleep on your side, with a caveat that you take your laxatives every day or every other day, and just make sure that everything's flowing freely, and to make sure that your abdomen is clean as possible. Because if there's too much stool inside your abdomen, then it can press on your catheter, and you won't be able to do dialysis properly at night, and your machine will keep beeping properly and keeping you awake during the night. So you'll see if there's a blockage in the line or if there's some kind of problem, then your machine will bleep as such. And this is indicating that there's probably some sort of fibrin in the catheter or there's some blockage again. So you may have to change position in your bed. You may have to stand up out of your bed and kind of move around a little bit to allow your catheter to drain. If it keeps persisting, then there's probably some kind of problem with your machine, or there's probably some problem internally within yourself. So it may be that your catheter slipped around in your abdomen and you'll have to have another operation to get it switched or turned around, or the doctors may have to reposition your catheter in your abdomen. So it can be quite serious or it can be quite minor depending on what's going on. Another thing to know is that your abdomen will dynamically change size during the night because in my case, there's about 2 liters of peritoneal dialysis fluid which flows into your stomach and kind of expands it. And then all that 2 liters of fluid will drain out again at some point during the night. And this will repeat about 6 or 7 times over a period of 8.5 hours. I also have extrarenal fluid during the day, so about two liters worth of extrarenal fluid during the day. So it drastically expands my abdomen during the day, and dialysis is sort of occurring during the day as well, and then it'll drain out at night. This is because I don't pass much fluid, unfortunately, due to kidney failure, and because that normally stops urination and you can't pass fluid anymore. So I have to have more dialysis in order to remove more fluid. But some people's case may be different to mine. Another thing to mention is that you probably can sleep with another person next to you. So if you have a partner or husband or wife or whatever, you can sleep with them next to you. But just be again, you need to be mindful of where they are relative to you, as you don't want to make sure you want to make sure that they don't pull your line out or touch the catheter during the night or sleep on the catheter, as this is going to make your life much more difficult. So that's how you sleep on automated peritoneal dialysis. And as I said, it takes about 8 to 8.5 hours. I normally sleep for about 5 to 6 hours, and then I'm kind of awake for the rest of the dialysis for about 2 to 3 hours. I wish someone would have shown me this video before, so I would have known going into peritoneal dialysis how I might have managed my sleep, and maybe I would have got better sleep in the beginning. Some tips and tricks that might help are firstly that only go to sleep when you're extremely tired. Otherwise, you'll be tossing around in bed and you can't really turn around too much in peritoneal dialysis. Otherwise, it's going to affect your exit site and pull on where your catheter is inserted. Secondly, I'd say make sure that you take your laxatives as prescribed, or even if it's not as prescribed, just take a little bit less, but just make sure that you're taking some laxatives every day to ensure that your stomach is clean. Because if there's too much stool inside of your stomach, it's going to press against your catheter, and that's going to make it even more difficult to fall asleep. Story is that when I began peritoneal dialysis, after about a month or so, my dialysis stopped working properly, and unfortunately, I wasn't able to drain much fluid out of my stomach during dialysis. And luckily, the doctor told me that on the days when you're not working, try and take more laxatives on those days in order to clear out your stomach. Because at that point, I completely stopped taking the laxatives, thinking that I didn't need them and my dialysis was working really well. But fortunately, the doctor gave me this advice, and I took a huge dose of laxative. And the next day, my dialysis started working again, and I've been continuing to do dialysis for the next 3.5 years. So you can see how important laxatives are. As I said, even if it's not at the prescribed dose that the doctor tells you to take it, you can just try and take a little bit, and then maybe if it doesn't work, then increase the dose slightly. Another tip that I'd say is make sure that you empty your bowels before you go into dialysis at night, because you're not going to get a chance to go to the bathroom during dialysis. If you have a bathroom upstairs, then that might make it easier. But for myself, I only have a bathroom downstairs, so I can disconnect from the machine and go to the bathroom, but it takes a little while. So it's better to have an empty stomach before you go into dialysis. The final tip is just to make sure you follow what your doctor says. So follow your diet, your fluid allowance, and Finally, I know that this journey can seem extremely difficult and hard, and it can seem like you've been on dialysis for many years and on the kidney transplant for a very long time until you do find your next donor or living donor transplant or deceased donor transplant. However, it will all be worth it in the end. Know that this form of dialysis gives you a certain type of freedom which something like hemodialysis may not allow, and therefore you may be able to live a better life with better quality compared to hemodialysis. However, it can still seem difficult, so it may feel like you you have your regular day job and then you have another job doing dialysis at night, especially if it's not working very well, which is why obviously taking laxatives and looking after yourself is extremely important. I guess the last piece of advice is that I give is try to live your life like you're not on dialysis and just keep living, keep going, and you will get there eventually and get the next kidney transplant. Thank you.